Hello and welcome to South First. I am Sumit Jha. It's an overwhelming moment for me as I am sitting in front of a person whose work I admire a lot. For many of us, sometimes our elders ask us to do certain things, and sometimes society certainly makes us not question the status quo. One example of this is Ayurveda and homeopathy. When we get sick, our elders bring some Ayurveda product and ask us to consume it. And on other hand, society certainly asks us not to question the practice of Ayurveda, homeopathy, or naturopathy in any form, as they sealed it with a wall of culture, history, and tradition. Today, we have Dr. Avi Phillips with us, who is a hepatologist and clinical scientist at Rajagiri Hospital in Aluva, Kerala. He is breaking the status quo with his evidence-based scientific work, debunking the narrative of alternative medicine that is quite prevalent in our society. He is a fearless doctor who doesn't give a damn about what people say. On Twitter, he is known as the liver dog. Welcome, Dr. Phillips, to South First.
Yeah, thank you, Sumit, for having me on your show.
My mother suggested that I drink milk. I should drink milk mixed with turmeric and make kadha by boiling black pepper, then clove, and it will help in my cooling down my throat. And she also believes that how to say this? She sent me a drink to try, but there is no information on this bottle, such as the name, expiry date, or like the manufacturing date. On other hand, I also have a paracetamol and a cetirizine tablet. I'm not sure which option to choose to relieve my symptoms. Should I go with turmeric milk, kadha, or this unknown drink which my mother has parceled me, or the paracetamol tablet? And why should I take any of it? Why should I take this kadha, or why should I take paracetamol, and why shouldn't I take this kadha or this drink?
Yeah, so I mean, it's good that we have these choices and we have to answer these choices. It feels like I'm doing multiple choice questions now. During my PG exam. So basically, I mean, when you look at the disease per se, you have probably a viral flu, a cold,
Yes.
what we call commonly. And it is usually a self-limiting disease. For example, even if you like, there is a saying that if you treat a cold, it'll go away in 7 days. Even if you don't treat it, it'll go away in a week's time. So that is how these diseases are. These are self-limiting diseases. The self-limiting diseases only require symptom care, which means if you have a runny nose, you take some tablets to reduce a runny nose. You have a fever, you take a tablet to reduce the fever. You have a sore throat, you take some lozenge to reduce a sore throat. So that is all that is required. So if you look at it, it's no big deal because it's just symptomatic care. It's a self-limiting disease. But the problem is that people are confused about the choices for their symptomatic care, not knowing that this will actually self-limit on its own pace within a few days or a week's time. So that is when they go for all these natural therapies, thinking that they are actually safe. So when you look at turmeric, so it's a very commonly used, kitchen method.
Household product.
Exactly. A very commonly used traditional hack, if I may add, for colds and cough and all that. But what most people don't understand is that turmeric, when taken orally, directly in milk or in water and whatever, it actually does not get absorbed at all in the body. About less than 2% of turmeric gets absorbed, and the fraction of the bioactive component in turmeric, which is known as curcumin, is negligibly absorbed in the body. So there is no point in actually consuming turmeric directly in milk because it never gets absorbed. So that is why a lot of these turmeric supplements now come with added pepper. So when you take turmeric along with pepper, the absorption actually increases. So that is why you have supplements with turmeric and pepper in it. That is pepperine.
Yeah.
So basically, people also say that, add turmeric and pepper along with other things to increase absorption. But even then, what turmeric does is actually not clinically or in a real life situation in a group of patients, not convincingly proven, because there are a lot of studies on turmeric and its anti-inflammatory, antioxidant, even anti-cancer properties. but none of this is actually proven in humans. We have a lot of lab data, and
Mhm.
all of the studies that you see are very small scale studies without any actual proof in it, even in the clinical sense. Turmeric, just by taking it orally with milk, that is haldi doodh that commonly people take, does nothing to you. It just gets excreted in the stool because
Yes.
it does not get absorbed at all. So there is no actual effect in the body. So people will ask, what if I take turmeric for, in larger doses
Yeah.
for the duration of the illness? The problem with taking turmeric in larger doses is that it is actually toxic. Turmeric is one of the commonest causes, I mean, one of the most commonly studied causes for liver injury in the world. And the Italian government has actually banned turmeric as a supplement for use in any diseases and has given a warning that turmeric supplement should not be sold over the counter because their pharmacovigilance has identified a lot of turmeric induced hepatitis in the population. And this is well researched and published. And this is taken by the Italian government. It is not by some company. It is the government's decision there. So they'll ask, what happens if, we are taking turmeric every day in our cooking, right?
Yes.
We take it in our meal. So why is that not harming my liver? That is because it is a cooked product. So when you cook something, when you add something as in past part of cooking, it actually reduces or destroys a lot of these bioactive components, the toxic agents, so that you are able to consume it. Right. So it's different. So don't get confused between turmeric in your diet versus turmeric as a medicine. Turmeric as a medicine has no role and it is potentially toxic. So that is why you should not take turmeric during your cold and cough because it is not beneficial and taking large amounts can actually harm you. That is your first point. The second point is that unlabeled kada or whatever that we are
Yeah.
using. I mean, in the similar sense, if you look at traditional medicine practitioners, they actually give such decoctions
Yes.
to treat a lot of diseases, not just cold and cough.
Even
The
during
biggest
COVID,
problem
it
is that,
was suggested. Even during the COVID-19, many doctors, many practitioners have suggested that you should take kadha and it will help you in.
exactly. So, yeah, it's the same story because if you don't know what it does to you, we don't know what taking kada with all those ingredients does to your body, how it acts at different levels in your body. We have no idea. And most importantly, there is no benefits actually proven in such practices. And a lot of patients actually have taken kada with giloy, the giloy juice
Yes.
kada, which is actually very, very dangerous because we ourselves have published the largest numbers of patients with giloy liver injury. Giloy liver injury is very, very common in our part of the world. And we have at least, I mean, if you look at all the publications from India, there are at least more than 200 cases published already on giloy liver injury from India alone. And this is actually what happens when you do something without actually knowing what it is. So even that kada and that unknown, unlabeled products that you're taking as some relief for self-limiting diseases, it can actually harm you because you don't know actual benefits and you have no safety data in it. So
Okay.
that is why you don't have to use unlabeled herbal products. You don't have to put yourself in danger. The third aspect is your paracetamol, right?
Yeah.
So we all know paracetamol. It is the most demonized medicine in the world, but it is actually the safest fever medicine in the world when it is taken as per recommendation for the required duration. So there is no point of taking paracetamol as a course, right? Nobody does that. Nobody gives paracetamol as a 1 week course or a 2 week course. It is taken when it is required and it
Yes.
is taken in a dosage which is recommended. For example, for my liver disease patients, I am not supposed to go beyond 2 grams per day of paracetamol up to 3 days.
Okay.
I can safely give them 2 grams per day for 3 days. No issues there. And if they require more doses, I would probably actually split them across many days so that they remain safe. So with paracetamol, you actually know how it acts, the mechanism of action, you know the side effect profile, you know the dose which is safe, you know the dose which is not safe. So it is much easier for people to prescribe and use that. Because when I prescribe something that I know about, it is easier for me to warn my patients also about it. If they actually cross the line, or if I want to cross the line, I can be actually wary about what can happen to my patient, and I can actually hold back so that I'm not going to harm that patient. So the whole aspect of first do no harm comes in modern medicine. It does not come in alternative medicine. They don't have that idea of it at all. That is why you should go with scientific evidence-based medical management for any disease condition, acute or chronic.
But my mother trusts turmeric milk more than the paracetamol, more than any allopathic medicine, so-called allopathic in terms of my mother. Why should I trust allopathic medicine?
See, the aspect of trust
Hmm.
is different from the aspect of evidence, right? So basically, it is something like religion. So I believe there is God, but if somebody asks me, please show me God, I cannot.
Okay, okay,
I can actually say that God is in me, God is in that lamppost, God is in that table, God is in the chair, and I can do a lot of descriptions around it, but I cannot actually show God. The same with the trust in turmeric. So if I ask somebody that, so you trust turmeric, tell me how it acts and tell me how long I should take it, in what dose I should take it for me to feel that actual difference in me or for symptom reduction, they will not be able to give you an answer. So that is a problem with believing something. So if belief is different from actual evidence. So I think what we should do is that we should actually shed our beliefs when it comes to healthcare
okay.
and trust the evidence. That is more important.